What sort of types of psychological consequences do you see in your cases?
Therapy, counselling is often of more benefit once the litigation is over, because the litigation is so stressful in and of itself.
You can make a compensation claim for the individual who's been injured and has the sort of the primary psychological trauma, but what about all of those around them?
The psychological impact can also lead to an increase in a need for care and support.
For many people, they don't want to be defined by their injury.
It's not their fault. They're not the expert in that room.
Hello, and welcome to today's episode of Medical Negligence Matters. Today we're going to be talking about the psychological impact of medical negligence, and with me to discuss that is my friend and colleague, Corrina Mottram. Hello, Corrina, thanks for being here today.
Hello.
So today our subject is psychological issues and the trauma that arises from clinical negligence or medical negligence. And of course, primarily when people think about medical negligence and injury claims, they're thinking about the physical injury more than anything else. And that's probably the first thing that occurs to people. But in fact, in most of the cases that we come across, the injury goes far beyond just the physical aspect. Isn't that right?
Absolutely. I think there are some cases where there's often a psychological impact in terms of the anxiety that's caused by having a physical injury, particularly where you don't know what the long-term position is going to be, to what extent will you recover, and what will the impact of that be on your kind of long-term security and your financial position, your ability to work and care for your family or whatever it might be. And also there are those cases where actually the primary injury can be psychological, particularly some of the saddest cases we see are those mothers whose pregnancies have been affected by medical negligence, and either they've lost their babies or the babies have had very, very difficult starts to life.
Yeah. And I think maybe one of the things that's always struck me is that in medical negligence, the psychological aspect can often be even more significant than in ordinary accident cases like road traffic accidents. And I've often wondered why that is. And I think possibly part of the complex is really that when somebody is having medical treatment, they're putting their trust in medical professionals to make them better. And in fact, when that goes wrong, quite apart from the physical injury and the trauma of that, there is, I suppose, almost a sense of betrayal or a loss of trust, which I think underlines quite a lot of the psychological impact.
I think that's exactly right. And I think what we see from an awful lot of our clients is that sense of betrayal and anger that even they can't quite understand sometimes, or can't quite articulate sometimes, about the fact that they have gone in with a problem to see someone who is meant to be helping them to resolve that problem.
And what sort of types of psychological consequences do you see in your cases?
We see a whole range of things, really. So there are a lot of people who have heightened anxiety as a result of what's happened to them. Sometimes people have a depressive illness of some sort. Sometimes people have post-traumatic stress disorder, PTSD, as a result of very significant events that have occured. And
yes, so they sometimes have those sort of classic presentations of the flashbacks,
insomnia. All of those sorts of problems.
And all of those things can be very debilitating and very limiting, quite apart from the physical side of things. And I suppose we're talking initially about the individual who has been injured, but of course an injury can have a ripple effect that goes beyond the individual who has suffered the injury themselves. I mean, to family members and to friends.
That's absolutely true. One of the things that we often think about in these sorts of cases is how can we properly reflect the kind of care that family members have had to provide to the injured person in terms of additional support, in a lot of these claims we may be looking at a claim for care where someone has been physically disabled to a degree for a period of time where they can't do their normal household chores or what have you, but the psychological impact can also lead to an increase in a need for care and support, just in terms of helping people get through the day and get through their normal life.
Yes, I mean, I'm very conscious often that for family members and friends, actually witnessing an injury and the impact on a loved one is, one can't underestimate how traumatic that in itself is. And I think that for many people, I often ask the question, well, you can make a compensation claim for the individual who's been injured and has the sort of the primary psychological trauma, but what about all of those around them who witness the effect of that? And that's very tricky, isn't it?
It's very tricky. It's become much more difficult recently in that there has been a decision from the Supreme Court that says that those family members who witness, what we used to call them secondary victim, well, we do call them secondary victim claims, who witness the injury can't bring a claim for compensation themselves, no matter how traumatic the events, except in very, very limited circumstances that are very, very difficult to imagine something that's actually going to happen that would meet those criteria. And so family members who see something devastating happen to a loved one can't bring a claim for compensation for themselves anymore.
Yes, certainly in the medical negligence field, that's right, isn't it? But I think, we certainly will take into account the effect on the family as a whole, but say injuries and psychological impact on connected people isn't necessarily something that sounds in financial damages. Thinking about the sort of the practical side of how we go about helping people who've suffered a significant psychological injury as part of their medical negligence claim, what sort of practical advice do you think it's helpful to give to those people?
Well, I think people need support through those things. What we will always try to ensure that our experts have done is to look at the psychological impact. If it seems necessary and appropriate, we will obtain psychiatric evidence that will define the nature of the injury that's been sustained and give recommendations for treatment that will hopefully put that person back on a stronger psychological footing so that they can move on beyond the injury that they've sustained. And that's usually through, a form of counselling or therapy. The number of sessions, the type of therapist they might need to see will be different in all sorts of different circumstances.
I mean, that's right, isn't it? I mean, I think the important thing is there isn't one size fits all as far as sort of therapy is concerned. And I think different types of therapy and different sort of counselling styles will benefit different people. And I suppose it's finding the solution that's tailored correctly for that individual. And also, I guess the other point is that it's quite expensive. I mean, in this country, I think that the state-funded psychological support is very, very limited and very difficult to access. And so I suppose that is one very significant benefit of being able to bring a claim for damages, is being able to use some of that compensation to fund counselling and support.
Absolutely. We will build that into the claim. So if we have a report that recommends 10 sessions at £100 a session or whatever the figure might be, we will claim that £1,000 as part of the compensation figure so that money is then available for the individual to access that therapy at the time they feel is appropriate for them. And
I mean, quite apart from counselling, I think it's probably worth pointing out also that there are, quite a lot of support sort of groups, charities and organisations that are very experienced in providing help for people who have suffered injury and trauma. And I think most good solicitors would be able to signpost people to those sort of organisations that might be able to provide more practical support, listening ears and that sort of thing. And compensation, so financial compensation, I think what many people would say, well, it's not really about the money. When you've gone through this sort of trauma, the money isn't ever really going to put right what's gone wrong. But it can be used, as you said, to fund some support which might help the individual get through the process.
That's right. I think it could help them to overcome the difficulties that have been put in their path. through no fault of their own. And I think that's a really valuable part of what compensation can achieve. I think the element of compensation that is to simply kind of recognise that you've suffered an injury is often the least important part of it. It's often those things that are to reflect tangible financial losses or expenses that you will incur that can be most valuable to people in a practical way, because they enable them to get help for the things they need help for, to give them that financial security that they were frightened they might have lost or that would have been upended to some extent.
And do you think that sometimes it can be difficult for individuals who've been injured perhaps to be aware or to recognise in themselves the extent of the psychological difficulties that are being caused to them by the injury? Do you think, and perhaps a little bit of denial sometimes? I mean, people cope with things in different ways, don't they? And I think sometimes it does need an experienced professional to sit down with an individual and to recognise that maybe some of the behaviours that are symptoms of an underlying problem that the individual hasn't recognised in themselves.
I think that's exactly right. I think one of the things that we are, because of the amount of experience, if you go to a firm of solicitors that are very experienced in doing this kind of work, they will know, they will be looking out for little telltale signs that actually this has had an impact beyond what the individual might recognise, and that is usually going to be in the psychological area, for want of a better phrase. And it may well then prompt the solicitor to say, can I have a chat with your partner or, a parent or someone close to you? Because it'd be quite good to get a perspective from somebody else to understand how they see what's changed.
I think that's right. We're not always good at seeing things in ourselves, are we? And it might need a family member, someone who sees the individual on a daily basis, to recognise that there might have been a change in behaviour or a change in mood or a change in personality. And you mentioned sort of the role of legal professionals, and I think that my feeling is that when somebody has suffered a psychological trauma, it's very important for their lawyer to, I suppose, perhaps have an extra element of empathy in the way that they deal with that individual. I mean, lawyers are not counsellors. We're not sort of qualified medical professionals. But I think in order to make sure that the claim is dealt with in the best possible way, there has to be an extra awareness.
I think that's absolutely right. I think it's so important for those clients who already feel let down by professionals to feel that the person they're sitting in front of understands, to the extent that anyone can understand who hasn't been there, what they're going through, is patient, is kind and compassionate in the way that they're dealt with. We're not there to be, their best friend. We are there to do a job, but the best way of doing that job for many clients is to be kind, is to be compassionate, as well as, when we're not in front of them, doing a really good job of getting the legal stuff right and making sure that we explore everything properly.
I think, in my experience, one of the most important things is to make people feel comfortable in speaking to you so that they feel that they can be entirely open about what they're going through. Because I think that many of us are perhaps not very good at talking about our feelings. And this idea of a stiff upper lip, let's bottle it all up and pretend everything's fine when it really isn't. And I think we need people to feel that they're in a safe space so that they can really be entirely open about the extent of the impact upon them.
That's right. I think we need people to be free to feel a bit vulnerable in front of us so that we can really understand things and make sure we get the right evidence. And they're only going to open up to that extent if they feel that they're safe to do so, as you say, and that we are listening and we understand, and we're not just going through a tick box of questions, but that we're responding to what they tell us And
I think that it's another important aspect, isn't it, is the fact that the process of bringing a claim itself is stressful. And I know I'm very conscious that when somebody is already feeling very psychologically vulnerable, the idea of then embarking upon a litigation process is just overwhelming. And I have to be truthful, there's a limit to the extent to which we can remove that stress. But I think a very important part of the lawyer's role is to support the client through the inevitable stress of that process.
Yeah, I think it's so important that they feel that we are on their side, that we are trying to take care of everything for them to the extent that we can, that they aren't having to deal with barriers, we are dealing with those for them, so that they can be free to just trying to get on with rebuilding their lives, and we will deal with everything else, and just kind of bother them with the odd thing that they need to sign and talk to them when we must talk to them, not kind of try and bring it. Because I think that people who have been through these kinds of events are trying to move on.
Well, I'm trying to think about the sort of the idea of moving forward. I'm interested in that you raised that, because I think that is, I suppose, the best endpoint that we can aim for really is to allow people to go through the process, but really feel at the end of it that they can move beyond it. Because I think that for many people, they don't want to be defined by their injury. That is not their whole life. That they need to know that they can go through the process, they can get the answers. And I think that's a very important part, isn't it, really, is to understand why things happened in the way that they did, and to have some independent examination of that, I guess, so that they feel that it's not just being swept under the carpet, it's being sort of fully addressed. But then also enabling them to, at the end of the process, draw a line under it and think, okay, well, that happened. We can't wipe it out, but we can move beyond it. And I think that, and we touched on this earlier, this idea of the compensation being used to fund treatment. And I think for many people that is helpful. And so they might not necessarily want to have the treatment straight away. Sometimes I think it's good to know that the money is there in the bank, so that at some future point when they feel ready to do that, they can undergo the treatment and help to sort of make themselves feel, entirely human and whole again and ready to face the future.
Yeah, I think many of our experts tell us, our psychiatric and psychological experts tell us that, in fact, therapy, counselling is often of more benefit once the litigation is over, because the litigation is so stressful in and of itself that actually trying to deal with the underlying problem whilst that very stressful process is ongoing can be counterproductive, or at least not as successful as it would be once the litigation's finished. So I think for many people, not embarking on that treatment regime until the litigation is complete is by far the better decision. And everyone is individual and they'll make the decision that's right for them. But I think moving forward often involves getting treatment at that point and being able to really properly close the door on what's happened to you, because the whole thing is over, and you can look forward without being constantly dragged back because the claim process isn't finished yet.
So just thinking, Corrina, about examples where people have been able to move beyond the immediate problem and the trauma that they've experienced. And I know it's very difficult. We've dealt with very many cases over the years, and it's difficult to talk about individual circumstances. But obviously we would never do anything to sort of reveal personal information about the clients that we've dealt with. But I'm just thinking whether there are sort of scenarios that you can remember where you sort of feel people really have been able to resolve some of the psychological trauma that they've suffered.
I think so. I mean, I think I've dealt with a number of cases, particularly in the kind of pregnancy and childbirth scenario, where mothers who have had concerns about what is going on and on a whole range of issues, they've been reassured that there's nothing wrong. They've got nothing to worry about. Everything's fine. Baby's all right. Mum's all right. And they have accepted that reassurance because it's being given by a medical professional.
Actually, that's true, isn't it? I think we hadn't really touched on this, but the fact that for many people, there can be a great sense of guilt and responsibility when there's been a tragic outcome, particularly from something like a pregnancy, that mothers can feel very guilty and feel like maybe this is my fault. Maybe it's because I wasn't vocal enough, I wasn't demanding enough. And I think we can do a lot in that investigation process to reassure people that actually it's not their fault.
No.
And that what happened is not something that they really had any sort of agency in. And I think that being able to resolve that, although it might not ever really entirely go away, but people can feel a bit better about what happened.
Absolutely right. I think with the treatment that they can hopefully obtain through, therapy and what have you, and also just the conclusion of the litigation process, where they get those answers and they come to understand rationally and emotionally that actually they weren't responsible. The fact that they didn't push, they didn't harangue, they didn't, repeatedly raise the same concern to the same person time after time, it's not their fault. They're not the expert in that room. And they shouldn't have had to push and harangue or whatever. Yeah.
And I think that the other point that I know that many clients have sort of said this to me at the end. I think the feeling when the process is resolved and having gone through the process, they can feel that they're not a victim, that they're not somebody that things just happen to, that going through the process and having the help of experts along that road enables them to sort of feel that they've taken back control. As I say, they're not a victim, but they're somebody who has suffered sometimes an unspeakable tragedy, but has, with assistance, been able to answer some of those questions and to feel that they have, taken control of the situation and moved on.
I absolutely. I think as human beings, we have a need to understand what's happened to us, and when we don't understand it, it's that confusion can be a real stumbling block to moving on and progressing through the rest of your life. And getting those answers in whatever way they come is, I think, incredibly helpful for people.
Thanks, Corrina.